New U.S. virus cases have now topped 60,000 in a day for the first time ever. Texas, California, and Florida all reported a record number of deaths. Worldwide, cases of COVID-19 have now topped 12 million, and the U.S. continues to make up a large portion of that number. Almost 3.12 million people have now contracted the virus here in the U.S., which has resulted in more than 133,000 deaths. The growing number of cases in the U.S. not helping President Trump at all. A new poll from ABC Ipsos finds 67% of Americans disapprove of the way President Trump has been handling this pandemic. As I mentioned just a moment ago, an encouraging headline about the coronavirus, Gilead saying its Remdesivir coronavirus treatment reduces the risk of death. And that looks to be bringing the futures off their lows this morning. Joining us now to talk more about this is Dr. Dara Kass. She is Yahoo medical contributor and Columbia University associate professor of emergency medicine. Dr. Kass, good to see you on this Friday. I know it's breaking news, but just want to get your reaction to this headline we're seeing about Gilead. Should the market get all excited about this?
I do wish the market would wait just a minute. Right now, we have a headline and no content. A lot of times lately, we've seen press releases about the study, and that's also not a great way to follow science. We'd like to see the study to prove that remdesivir does decrease death, and that would be remarkable, an encouraging piece of news out of this coronavirus pandemic, but we just don't have that information yet. Right now, all we have is a headline.
Dr. Kass, clearly the infection numbers are they're not going in the right direction. What do you expect to happen this weekend?
So actually, numbers are reported in a lag a little bit over weekends, and that's part of the reason we're seeing such a high number of cases increase after the holiday weekend, and we saw a lull on Sunday and Monday. So I expect to see an increasing number of cases. The weekend may be a small dip. That's usually in reporting, not in actual case numbers, but unfortunately, there's not a lot going on to decrease the number of cases, and so I expect to see the numbers continue to rise.
You know, doctor, there's this German biotech company that has partnered with Pfizer to develop a coronavirus vaccine. They say they can get this approved by the end of the year. Do you think that that timeline is feasible?
I think that approvals are easy to get right now. Regulations are low for the vaccine trials because people want to see these trials get into phase 3, which is really when we see their safety and efficacy in people. So I think that that is probably accurate. I think that there are right now 17 clinical trials going into phase 3 trials or near phase 3 trials. This is an mRNA vaccine, which we've never produced before, but it is probably a good way to get a vaccine for this virus. So again, encouraging news on the vaccine front, but nothing I would wait for to start opening up schools or the economy.
Dr. Kass, Jared Blickery here. You mentioned some fluctuations in the data. What would you need to see in the data to get you more positive about the direction we're going here?
So I think the number we talk about a lot is the positive test rate. And that really has to do with the number of cases that you're seeing and testing and how positive they are. And the reason that's important is because it really shows robust testing and an ability to test not just sick people, but people that may be asymptomatic carriers, people that may be in the quarantine, bubble of somebody who may be infected. And that really is where we're going to hit the virus from spreading to other people. So we want to see a positive test rate under 3% with a reasonable testing strategy. If you stop testing everybody and only test people that are walking well and nobody that's sick, you could artificially get that number down. But we're looking at numbers like New York, where we see 65,000 tests done a day and a positive test rate just about 1%. That is robust testing that's going to keep us to find out where the virus is when it pops up.
Dr. Kass, is it safe to send children, based on the data we're seeing now, is it safe to send children to camp?
So camps are interesting. Overnight camps, I had taken a stand on a while ago saying I just don't think they're the right move right now. And it really has to do with quarantine of cases and the spread of the virus. We've seen a camp in Missouri that had 82 cases come out of the overnight camp for teenagers. And most of those cases weren't identified until the kids were back home. So they'd already left the camp and reinfected 10 different states and different communities. And that's just not what we want to see. Day camps are different. They're a good pilot for schools because the bubbles are smaller. And if one group gets infected, it shouldn't affect the other groups as much. So I think day camps are okay if you're in an environment with a low disease prevalence, so a positive test rate really under the 3%. And you know in your family that you're taking a risk of exposing your family to the virus and seeing what happens.
Along those lines, Dr. Kass, what do you think about reopening schools in the fall? President Trump has been pushing states to do it. He's saying he may withhold federal funding if they don't. What's your feeling on, and what do you think the probability is that we really get back into the classroom this fall?
So I think going into the classroom for a day or two is likely everywhere. Everyone's going to try it and a lot are going to fail. I think what's going to happen is we need to see investments in the communities for the schools. We need to see federal investments in, the abilities of states to exponentially increase testing now, to increase tracing, to maybe even supplement teachers and other, classroom professionals so that we can decrease the density of kids. If there's a class of 24 kids and one kid gets the virus, that is very different than a class of 12 kids or 8 kids and one kid gets the virus. So I think we need to see investments in communities to start opening schools, but in the right environment, I think you could have schools open sustainably. And I'm very optimistic that that's possible in communities that are doing a good job keeping the virus at bay.
We like to hear when you're optimistic. Dr. Dara Kass, thanks so much for being with us as always.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.